Good morning, Sabah al-Khair, Your Excellency, distinguished guests and friends of ERF, our affiliates, friends and colleagues. Sabah al-Khair, lovely to have you all with us in Naharda. It's such a pleasure and an honor to be welcoming each and every one of you, both who were able to join us in person and who are able to join us online, for a very special topic that ERF has been working on for quite some time now, a topic that is much needed, a rethinking process, a reimagining social protection in MENA. And we could not have been honored to have such a distinguished panel for the opening session, to have with us Her Excellency Dr. Naveen Al-Qabbaj, to have with us Dr. Ibrahim Badawi, to have with us Dr. Sabah Al-Mubaslat and Dr. Ragi Asad. I'm not going to take much time. I just want to very briefly introduce our welcome note speakers, Dr. Ibrahim Badawi, followed by Dr. Sabah and Dr. Ragi, and then go straight to Her Excellency Dr. Naveen Qabbaj with her opening speech. Dr. Ibrahim Badawi is our Managing Director since 2017. During the period, he was also Minister of Planning and Minister of Finance and Economic Planning from September 2019 to July 2020, and he's got a fantastic long record of leadership positions with the World Bank and the Dubai Economic Department. Without further ado, Dr. Ibrahim, the floor is yours for the welcome note.
Thank you very much, Shireen. Let me make my opening remarks in Arabic. معالي الدكتورة نيفين القباج وزيرة التضامن الاجتماعي، الضيوف والمشاركين الكرام، إنه لمن دواعي سروري البالغ أن ألقي الكلمة الترحيبية في مؤتمر اليوم نيابة عن منتدى البحوث الاقتصادية. بداية أود أن أرحب بمعالي الدكتورة نيفين القباج. إنه لشرف عظيم أن تكوني معنا اليوم، ونشكرك على تخصيص الوقت للمساهمة في المؤتمر وإلغاء الكلمة الافتتاحية. السيدات والسادة، إن الحماية الاجتماعية ضرورية لبناء عالم أكثر عدلاً وإنصافاً، فهي تساعد على الحد من الفقر وتعزيز الإدماج الاجتماعي وحماية الناس من المخاطر والصدمات. وفي ضوء ذلك يسعى هذا المؤتمر إلى تشجيع مناقشة الوضع الراهن للتأمينات الاجتماعية والضمان الاجتماعي في مصر، والتفكير فيها ومقارنتها بنتائج العمل البحثي في الأردن وتونس لتعزيز التعلم المتبادل وفهم من خلال التحليل المقارن والمناقشة البناءة بين صانعي السياسات والمجتمع المدني والأكاديمي. ويمتد المؤتمر على مدار يومين، حيث سنعرض في اليوم الأول وضع التأمينات الاجتماعية في مصر، والتي تتميز بجوانب مثل القطاع غير الرسمي واقتصاد الرعاية والديناميكيات المختلفة للمجتمع. وفي اليوم التالي سوف نستفيد من الدروس المقارنة من تونس والأردن، حيث سنلقي الضوء عليها وعلى دور منظمات المجتمع المدني في الحماية الاجتماعية في هذين البلدين. وسيتم اختتام المؤتمر بمناقشة حول بعض المفاهيم المتعلقة بتغطية التأمين الاجتماعي وعرض وجهات النظر المختلفة، وسنطلب من الحضور أن يقرروا وجهة نظرهم فيما يخص الحوار الذي سيتم وإلى أي وجهة نظر يقفون. ونأمل أن يخلق هذا المؤتمر مساحة لتعزيز المشاركة المدنية ومناقشة الحلول على صعيد السياسات ومقارنة الآثار المترتبة على السياسات المختلفة، مما يؤدي إلى تبادل الأفكار حول كيفية تحسين أنظمة التأمين الاجتماعي في البلدان الثلاثة. وأخيراً، وقبل أن أعطي الكلمة للدكتورة صبا المبسلط وبالنيابة عن فريق المنتدى، أود أن أعرب عن خالص امتناننا لمؤسسة فورد لدعمها السخي لهذا المشروع. ونحن كذلك يشرفنا أن نكون شركاء في هذا العمل الهام الذي يجمع الباحثين بصانعي السياسات وأصحاب المصلحة الآخرين لمناقشة الوضع الحالي للتأمين الاجتماعي في المنطقة وتطوير أفكار جديدة حول كيفية تحسين هذه الأنظمة. وأخيراً أشكر جميع الفرق البحثية من الدول الثلاثة على جهودهم بقيادة الباحثين الرئيسيين راجي أسعد كارولاين كرافت وإيرين سيلوانيس. وأشكر جميع المشاركين سواء كانوا حاضرين شخصياً أو عبر تطبيق الزوم، وأتمنى لكم مناقشات سرية وبناءة، وشكرا لكم والسلام عليكم ورحمة الله.
Thank you, Dr. Ibrahim. Thank you, Dr. Ibrahim. I'm going to actually introduce Dr. Siba Al-Mubaslat in one word. Dr. Siba is the regional director for Ford Foundation, but I would like to introduce her as working with somebody who's really a visionary person doing work on the front line of social change. Fantastic experience in international development and also humanitarian response. And with that, I give you the floor.
Thank you. To be among friends and partners, thought partners, Your Excellency, distinguished guests. I'm here with a word written, but coming this morning, driving to the hotel, I was listening to the news. And your word, or our exchange last week, remind me of the importance of rethinking, not necessarily only social protection, but everything. I think we cannot pretend that it's business as usual. The world is changing as we, gather, trying to discuss what it means to be socially protected. Some may question, is this the right time to talk about social protection and research? And I say there has never been more important time than now to talk about social protection in an informed, evidence-based way. The challenges, the fragility of the world around us puts a lot of pressure and a lot of responsibility on all of us to better imagine or reimagine and rethink the best use of the limited resources. At Ford Foundation, we believe that social justice, not only social protection, is critical for political, social, and economic flourishing and stability of societies. And this region is, not that different from the rest of the world. Unfortunately, the middle class in most of the countries where your research is covering is diminishing. The reason for that is, the multiple layers of instabilities that we're dealing with. The unknowns, the debts, the food, fuel, and energy crisis, the debt crisis, and much more. The question is, with the limited resources we have, how can we set mechanisms that can stop the deterioration of the middle class and can include the excluded, because the excluded are becoming too many. My only request from researchers, I have absolute no doubt that your research is academic, scientific, based on facts, but please make it human-centric. Tell us the story of the human beings behind the numbers and the research. Tell us what does it mean for them to be included, because excluding them comes with a cost. Tell us how by investing in people, this part of the world will no longer be viewed as a troubled and troubling region, but rather a region that is extremely rich due to its youthfulness. I think we rely on you to put things in perspective, and we rely on you to inform us how to shape policies in a way that can make the best out of the human resources we have in this region. We work very closely with Dr. Naveen and with the Ministry of Social Solidarity, trying our absolute best to see how a targeted approach to social protection can help solve problems, get the best out of the people that are excluded at the moment, but at the same time, make sure that they are included. Their voices, their potentials, their dreams are all included and not excluded. We continue to partner with you for this part of the world to be a better place. I think before we start rethinking, we need to unlearn our very traditional ways of doing business and relearn how to work in a world where everything is being tested and challenged right now. We collectively are questioning so many concepts that we thought we took for granted. The concept of justice, equity, equality, international systems, everything is being questioned at the moment. So I can't see how our research can continue to do business as usual in a world that's being reshaped and re-questioned as we speak. I wish you the best of luck. I look forward to learning from each and every one of you, and I'm really eager to see how together we can rethink a world where we are all equal and where justice is for all and not for some. Thank you so much for including us. Thank you so much.
And from vision and passion to rethinking, I would give the floor to Professor Raghi Assad. Professor Raghi Assad is Professor of Planning and Public Affairs, University of Minnesota, a founding member of ERF. And we cannot talk about anything to do with labor or future of work or social protection without having Raghi help us guide the way for rethinking that process. Dr. Raghi.
Thank you very much, Shireen. Your Excellency, Dr. Niveen Al-Qabbaj, Minister of Social Solidarity, Dr. Ibrahim Al-Badawi, Dr. Saba Al-Mubaslat, representative of the Ford Foundation. It really gives me great pleasure to be here among you to talk about this very important topic. As Dr. Mubaslat said, these are unusual times where the crisis after crisis is really tearing at the strings of our heart in terms of what we can do to protect people from violence, from deep pain. And one thing we have learned as we have gone through these many crises in the previous years is that the existence of stable social protection systems that exist before crisis hits is very essential for social protection and for really reaching people during deep time of crisis. And we found that, for instance, when we were looking at the effect of COVID-19, that it was social protection systems that were already on the ground that did most of the work in reaching people, as opposed to programs that were tried to devise on the fly as the crisis was getting through. So really thinking about those social protection systems that are in regular times, non-crisis times, is really quite important. This conference is the culmination of a multi-year effort by ERF with the cooperation of the Ford Foundation to really rethink social protection in the Middle East and North Africa. The project initially focused on social protection broadly defined in Jordan and Tunisia, and we did a series of national consultations, workshops and conferences in these two countries, and a number of publications and policy briefs have come up, and I hope you all have access to some of this material, some of which will be presented tomorrow. Egypt was not added to this initial focus until later, and when the project was extended to include Egypt, the decision was made to focus primarily on Egypt's social insurance system, as opposed to the entire social protection system, which was the focus of the previous phase. And that's because we felt there was a series of questions and issues with the social insurance system in Egypt that needed to be looked at deeply. So this conference is showcasing much of the work resulting from this multi-year project, with the focus of the first day being on the work on Egypt, and then the second day will have more of the comparative aspects. There is a main question that is motivating the papers that, many of the papers that you will hear today, which is at a time when we want social insurance system to expand and to cover more people and to be more inclusive, what we've actually been observing in Egypt is just the opposite. There's been a decline in coverage that has been quite steep in certain years, with coverage, the fall in coverage really not explained by what's happening in the system. The coverage in Egypt has been rather low, partly because the labor market includes many forms of work that are simply difficult to cover given the framework of the social insurance system, which focuses primarily as an entry point on a stable employer-employee relationship that lasts for a certain period of time, and that is kind of the underlying philosophy behind the existing system. While there are other additions to the system that try to handle other forms of employment, like irregular work, temporary workers, with some reforms happening as late as 2019 in these. But we also have new forms of work, platform workers, gig workers, workers that use technology and remote work, that whose coverage is very incomplete because our system has not yet adapted to these forms of work. So the question is the coverage decreasing because these forms of employment are expanding over time? These forms of irregular or traditional employment are expanding over time due to structural adjustment and changes in the economy and in the technology? Or is coverage decreasing because we have declining coverage among workers and jobs that had been covered in the past and are no longer being covered? Now, this is really a very important question, and we try to provide some answers to these questions. Now, coverage could also be declining for existing jobs because the changes in the way the system is administered over time, as a way of doing adjustments that may have unintended consequences of a decline in coverage. There may be interactions between the social insurance system and other social protection systems like the Kaful and Karama program, which has expanded quite a bit in recent years. And there's also, we don't know, for example, whether the loss on coverage is because workers who are already covered are losing their coverage, or is it new workers coming into the system who are not acquiring that coverage at the same rate as before. There's also among self-employed workers, there were all kinds of ability for self-employed workers to join, many of them voluntary in nature. And is it because of the changes in the new businesses that are being formed, the informalization of these businesses, that we see declines in coverage among these groups? So we have a lot of series of questions analyzing what happened in the past. There were clearly some reforms in recent years with the 2019 law that might have changed the trend back up. But I think we do need to understand what happened, and we're going to be looking at the period going all the way to 2007 to try to understand what's going on with our social insurance system in Egypt today, and then we're going to do a more comparative view tomorrow. So I welcome you all, and I'm sure we're going to enjoy the conference today. Thank you.
Thank you, Dr. Raghi. And from thinking and examining and rethinking where we stand to actually what is the experience on the grounds, what have we learned, how are we doing, where are we going, with that keynote speech of Her Excellency, Dr. Naveen Al-Qabbaj, it's such a pleasure having her with us and having her tell us about the challenges of the policy front and making things happen. So in one word, somebody with the expertise that not only in international development, but also in really looking into the policies, the social protection, the child protection, and the monitoring and evaluation. So she'd be doing a fantastic job linking us to what's happening on the ground. Dr. Naveen, the floor is yours.
Thank you very much. Good morning, everybody. It's a great pleasure to be with you in such an important topic that is really I'm passionate about, and also with this distinguished panel that having also Dr. Hiba Handousa, our great professor and passionate and missionary person in development. So it's a great honor for me. And of course, all of the distinguished guests, I'd like also to welcome Dr. Ibrahim Al-Badawi, the Managing Director of the ERF, and thank you for inviting me. It's a pleasure and honor for me, as well as Dr. Saba Al-Mubaslat and Dr. Ragi Asad. Just before I start, surprisingly, we're speaking about social protection while other people and other children are surviving and looking for life protection in Gaza. So we're sending our support and condolences to the Palestinian martyrs, and our support to the Palestinian people in the resilience and overcoming what's happening in the region. And this is a part of our program today, because we exceeded and we overpassed social protection to other forms of protection, especially with wars, conflict, climate change, and occupation and other things, because we're speaking about MENA region. MENA region is not anymore consistent in terms of comparing the countries. It's becoming completely a different picture. So it gives me great pleasure to participate today in such an event. And social protection, we do believe, is a human right. And it's a long discussion always between the ministries of social development and the ministries of finance, whether it's a right or it's a grant. We do believe it's a right. It is simply the set of policies and programs designed to help individuals and societies to manage risks and volatility and protect them from poverty, vulnerability, and social inclusion. And we always focus on poverty, but there are other forms of exclusion, which is social inclusion, which is very dangerous and very risky, about being excluded from the job market, from the political participation, from the financial inclusion, from all of the rest things would lead us to even a more complicated pictures. This happened through instruments that improve not only resilience, but open opportunities and have some sort of equitable social protection. Throughout, I speak about throughout the life cycle of the person, starting from first 1,000 days in the lives of children, and protecting of the mothers, and protecting of infants and babies in terms of having maternity, and then also in terms of having job opportunity, social insurance, up till the social pension. So it's a complicated process that it remains with us for our life cycle. It's not only for the poor. It can also tackle the middle class, which is stuck in the region and stuck with the worldwide about the middle class. It is degenerating, and it's stuck between the upper class and the lower ones. And the disparity is being even more and more. Because we do believe that Egypt has lots of resources, but the issue of it's not necessarily with the state, but with the people, and with while having the disparity between the people. And we can see irregular consumption patterns that we really get ourselves surprised and ask ourselves, where is this? Are we studying really what's happening in reality or not? But it includes benefits for children, job opportunities, unemployment benefits, maternity benefits, as well as health protection and health insurance, benefits for people with disabilities, and for single-headed household women. This is added to the important role played by the pension systems in the Arab world in providing a regular income for pensioners, ensuring them against all forms of social risks, and improving the quality of their lives, and accelerating the achievement of sustainable development. Let's have a quick glimpse about the statistics in the region. 40% of MENA population enjoy effective coverage in one area of social protection. 23% of children only are covered by social protection benefits. 17% of people with disabilities have access to regular cash social protection and benefits, and in the meantime, they're excluded from the job market. And so they are really stuck between not having social protection and not joining the labor market. And let's put into consideration that the percentage of disability in the region, it ranges between 12 to 15%, like any other country in the world. 40% of people have retirement age, receive pensions. In Egypt, it's maybe a bit higher, but we have between around 10 to 12 million irregular workers that are deprived of social insurance, and that after reaching 65, they come to have karama. But in the meantime, the contribution of the casual workers to the social pension scheme is diminishing, especially after the reform of the social pension. 9% of the region unemployed people had access to unemployment benefits prior to COVID crisis. And finally, tax-financed social assistance schemes provide income support by nearly 25% of vulnerable people across the region. Education that is not necessarily tailored to the job needs would lead to limited work opportunities, and in the meantime, low productivity of informal workers have played a significant role in increasing poverty and vulnerability in the MENA region. Low productivity because of low-skilled or semi-skilled or non-skilled informal workers. The current rationale of today, I think is that not only to have effective public policy needs to focus on reducing poverty, but on reducing social inequalities. That is fundamentally due to the multidimensional nature and other structural factors related to the social economy and political relations that surround relations of economic production. Linking this with the macroeconomy and with the microeconomy is very much important. Looking into gender, class, religion, alhamdulillah, we're much better than, alhamdulillah, it's now better, and gender also, rural urban divisions, and increasingly the terms of trade in the global economy between developed and less developed. Even the people who are passing through the experience of SMEs are stuck with marketing issues, whether locally or internationally. The focus on such inequalities will also mean that economic development and social protection policies need. The issue is that we think of them separately, or when we are stuck with the economic crisis, we think of appeasing the people with social protection measures, but not doing this structural relationship between economic development and social protections. And actually, the causes of poverty, such as the informal rural work and the lack of access to credit or regressive taxation policies, and also added to the over-reliance in VAT in some MENA countries like Lebanon, which adversely affect the poor. There is a relative difference between one country and another, as there are countries that have established unemployment insurance systems in Bahrain, Kuwait, and the Kingdom of Saudi Arabia, and the improvement of benefit scheme from social protection. Motherhood protection and maternity benefit are quite good in Iraq and Jordan, as well as the developed pension systems. The region is not unique. The region is segmented exclusionary. It has also characterized by exclusionary social insurance schemes that rely on public sector and the social insurance of formal employment. And the formal employment now, Egypt adopts policies not to have formal employments in order to reduce the public sector. Coupled with a fragmented non-contributory system, women, young and non-national workers, including the refugees, have problems in being covered with social protection and are mainly due to the labor force participation and informal employment. Yes, the coronavirus or the pandemic added, and also the Ukrainian-Russian war have led to global economic crisis, which put its repercussions on the region, and the latest events in Gaza that nobody knows where it goes, and the scope and the extension and the length of time. This will also lead us to rethinking and reimagining about social protection, and that's why it's very interesting today to think it out. Social security has become more important than ever with the climate change, with the increase in casual labor, with the war conflict crisis, with the exchanges that are happening in the region. Given all the current challenges, protecting people from poverty through social systems is one of our priorities in Egypt. And let me give you a quick look on Egypt. Egypt tried as much as you can since 2015 to adopt social protection policies, starting with Takaful and Karama, which, while tackling poverty not from a unidimensional, it's not the lack of financial resources, but it's the lack of multi-dimensions in life, which means quality of living, health, education quality, not enrollment in education, but the quality of education, because we focus as a conditionality in Takaful and Karama on enrollment, but we have no control over the quality of education. Same for health, and also for household characteristics, and that's why Hayat Karima has been launched and expanded. Also the social and the socio-economic services, the financial inclusion, and so many things that are linked to each other. So let me give you a quick look about social protection in Egypt, because the labor force reaching about 31.9 million individuals, to increase by 3.2 in the third quarter of 2023, 13.9 million in urban areas, and around 18% in rural areas. More than 60% of the workforce in Egypt work in informal sector. And Egypt was able to make a historic achievement, although the impact of the result is not as extensive as we imagine while putting these policies together. Because, as I will just clarify right now, the increase in the target, the increase in the budget would originally lead us to better results. But with the changing economic situation, it's becoming even sometimes worse. It's protecting the poor from destitution, but they are still poor in most of the cases, and not necessarily in all of the cases, because some people were able to move not up completely outside poverty, but they achieved some sort of advance. So if we look at the beneficiaries of Takaful and Karama, they increased from 1.79 households to 5.2 million households in 2023 compared to 2014, which means an increase of a percentage of 200%. The budget has increased from 3.4 billion to 36 billion in 2023 compared to 2014, with an increase of 960 times. It means 1,000 times. 1,000 times increase in the budget. If I were, as a policy maker, I'm not, sometimes we're policy maker, sometimes we're policy taker. But I mean, if I were them, I would really get a bit disappointed, because after spending all of these resources, and this is also relevant to the cash transfer only, there are other sectors that are being covered, like the increase in food ration cards, like the and having the subsidy reform would have led us to better results. And that's why I'm saying that we are economically stuck, and accordingly and eventually the social protection measures are affected. Although the social protection policies that were taken should have protected us much more. This is only for the cash transfer, added to that we have cash assistance from NGOs. In the previous years, Egypt received around 60 billion Egyptian pounds spent on social protection and economic empowerment. The women-headed households, 720 women-headed households, are covered with 3.4 billion a year. Same for the elderly, covered with 3.2 billion. People with disabilities, covered with 8 billion a year. Around 27% or 28% of the beneficiaries of the cash transfer are people with disabilities. Although we should have a percentage that is relevant to the national percentage, which means around 12 to 15%. We exceeded this by far, because the the marriage, the intermarriage between relatives and the early marriage would let us even towards disability percentage, especially amongst the poor and in the rural areas. We adopted a program that's called Equal Opportunities for Education and in Health in order to give more chance for investment in human capital. And that's why we need not only to pay cash, but to pay attention to ensuring that nobody's left behind in terms of education opportunity and health rights. And that's why we invested in order to cover 5 million school students, and even we extended now to university students, because some university students were stuck and not graduated because they haven't paid their fees throughout the years. So we cover around 5 million students, mainly from schools, but also from universities. Added to that, we cover them, those who are that have health problems, like breast cancer, like severe cases of kidney failure, especially women, as women-headed households. This did not only was not only, and of course, 1,000 days in the lives of children. All the children whose household or whose families receive cash transfer are free out of education. We pay their education. So we find out that the country is also adopting a comprehensive and universal health insurance system that started in 3 governorates and then extended to 6 governorates, but still the level of the health coverage for the other governorates are paying from their pocket money and are sometimes preferring private sector than public sector. Speaking about the quality of services, and that's why Egypt and the political leadership has started with improving the lives and moving the people from slum areas to new settlements in order to have a full change, which is it was actually a program that costed a lot, having 1 million housing units, new housing units for people who do not pay, and that's why it also exacerbated from the economy for 1 million housing units, and moving people from the old settlements and the slum areas and unsafe areas to the new settlements. In consideration that you're not only moving them, you're changing all of their lifestyle with more of awareness classes, drugs and substance abuse, education. So it's a comprehensive vision towards having quality life for the people who are moved. This is concerning around 25,000 housing units were also furnished for the extreme poor who cannot even furnish their houses. We did not stop for that, but also the social services in Hayat Karima that expanded and that exceeded 1 trillion Egyptian pounds in order to reach more than 400 villages. I won't say the poorest villages, because they did not look only at the poverty factor, but they also look at the low services and low socioeconomic services, telecommunication, electricity. So there are around 17 or 18 ministries contributing to Hayat Karima. And that's why it's called Hayat Karima, which is a better life or quality life for people. Nonetheless, I mean, improving the services and having all of this stuff would not move us ahead that much or as expected as we need to go, except if we put people in the labor market. And that's why we're stuck with also, we actually parallel the social protection interventions with economic empowerment interventions. The issue is that it's not a matter of a person, it's an ecosystem in the village with the services, with the marketing, with the education, and like look at the small and micro enterprise. The central bank has launched a big program, and I do believe that it did not necessarily reach the poorest. It might have reached other classes. And that's why I sometimes speak about the targeting of the subsidy. Is it really reaching the poorest? Of course, the subsidy reform with electricity and gasoline and other stuff have helped a lot. But there's still a room for improving the targeting mechanism in food ration cards, in the subsidy, and in having or on putting taxation on the most luxurious items like what's happening right now. If we look at the SMEs, Nasser Social Bank is the economic arm for the ministry. It invested around 14 billion Egyptian pounds, getting only to women. I mean, the budget is even bigger. But the 14 billion were targeting middle class and lower middle class women. For the low income and the poorest women, we adopt a program in the ministry targeting around 532,000 projects while having a budget of 5 billion Egyptian pounds. We started, when Corona and when COVID-19 came, we're stuck with informal labor as if it's the first time to see them. The informal labor and the casual labor were there forever. But because we thought of it, how are we going to cover them with social protection measures, because there were no job market for them. And so the informal, we started having a database for the first time for informal labor in Egypt, and starting looking into the alternatives. If they are stuck, like the fishermen, for example, like the street vendors, like the people who are working in the recycling, the garbage collectors, like the drivers, like the delivery people who do not only have deprived from social protection, but also from health protection. I remember a delivery person who had a disability in one of the accidents, and then he came with his disability to continue, but asking for tricycle for people with disabilities, and he's continuing the same job. So, do you have life insurance? No. Do you have health insurance? No. Social insurance? No. But this is the only thing I can do. So even if I develop a disability from this job, I don't have any other alternative. So he's changing the equipment, but not changing himself. So I think, of course, we help them in marketing their stuff through Diarna and through initiatives that we are trying to adopt at the regional level in Bahrain, in Abu Dhabi, in Kuwait, in different countries. We're trying to help them out in order to market their stuff. And sometimes we do buy their stuff in order to have a running capital for them, so as not to be stuck, and then we manage either in marketing or in getting out as assistance. I think maybe there are certain regions in Egypt, like Northern Sinai, like Marsa Matruh, like Southern Sinai, and like Halayb and Shalatin, that needs more assistance. So we changed the proxy means testing, and we changed the poverty scores, because they have their own specificity in terms of being remote areas, being areas that are stuck with the job market, and that the women's situation in these areas need more attention, not in terms of empowerment, because they're quite empowered, but in terms of their economic empowerment and contribution to the labor market. So I think also, according to the social pension and the contributory social pension, we increased the minimum level for the contributory pension from 400 till it reached 1,700 in 2023, and also increased the maximum from 1.59 to 10.9 for the same period. So as you see, there are, and even the total budget for the social pension increased from 86 till it reached 340 billion Egyptian pounds a year. It is a costly programs that are being adopted, but what is missing is that the collective or the comprehensive vision. Why isn't it working? Because they are not aligned with the economic development issues, and this is added to the time of crisis. And I was just meeting ESQA this morning about the social protection disparity, especially at the time of crisis. And the crisis actually doesn't have to be like in Gaza or like in COVID-19, but there are other crises that people meet, and that we have a central administration that is working specifically on them. So I think one of the major obstacles for this is also population increase. And now we're about 110 million individuals in Egypt, and we are increasing. And also the other obstacle is the lack of awareness in terms of certain issues in development, like early detection of disability that can protect people from even having the disability more aggravated, like violence against women and children, like drugs and substance abuse, like climate change, because people are aware of the awareness of real climate change, and they think that the climate change is something very elitist. There are climate change and behaviors at the bottom level that we really need to adopt and to raise the awareness of people. I think the social protection budget at large, it increased from 15 billion in year 2000 to around 550 billion in 2023. But the percentage of having this is not increasing. I mean, the amount increased, yes, but when we measure the percentage of having it from the GDP, we can say that it's quite decreasing. There are other benefits, of course, to the health and education, but nonetheless, it is more even exacerbated. We adopted parallel programs for literacy, for financial inclusion. Nearly, we have 11 million smart cards. We are the biggest ministry that is adopting financial inclusion because we have the pensionaries, all of them are paid through smart cards. We have all of the Kefal and Karama people are paid through smart cards. We actually increased the number of community workers from 2.5 to 15,000 community workers in order more to work on the awareness. And we started to develop some sort of household observatory or family observatory in order to monitor. It's a very big one. It's nearly monitoring around 3 to 4 million households 4 times a year in order to through having the 15,000 community workers that collect information. We need to get in depth in these communities and know the specificity of the phenomenon because it's not unique. At the end, I mean, I think that civil servant employees, I mean, also although in spite of the increase that they are having one year and another, but they are still stuck with low payment and inability sometimes to pay some of the basic expenditure. We started also to have food security issue in Egypt is secured, but we cannot rely on this security and just it, because the nutrition percentage for children is very bad. Based on the estimate or the expected nutrition, the children suffer from more stunting, from having other problems, and that's why the Ministry of Health is investing lots of effort, but not only the Ministry of Health, it's ourselves, it's other ministries, in order to work on the increase or the improvement of nutrition. Actually, on women, the National Authority for Social Insurance is responsible for providing paid days off for expecting mothers for 90 days in the private sector with 75% of their last insurable salary. So we also have a disaggregated program targeting women, people with disabilities, children, people who are living in remote areas, rural areas, and casual labor. So the different the programs that we have still are stuck with a labor market that is not active enough in order to adopt and to include the development of also the green aspects. Green aspects and green economy and green bonds are just statements that we like to say, but we're not really integrating into the economy. And we're trying as much as we can, and I know the Ministry of Environment and the Ministry of Planning are paying efforts, but still we need to get this down to the communities. I think MOS has financed a lot in terms to contribute to the government's Vision 2030 in creating an inclusive society through the provision of support mechanisms to protect people living in extreme poverty, vulnerability, and exclusion. And we're even now responsible for the civil martyrs اللي هم الشهداء والمدنيين الشهداء والمصابين المدنيين. those are victims of extremism and who are they're around above 6,000. So I'm not speaking about the ministry only, but about the comprehensive vision that the government is adopting. Finally, the importance of exchanging experiences in social security systems and restructuring the systems in order to keep pace with the changes and the dynamic situation, because sometimes we adopt policies and then we get some rest, and we do believe that they are the extreme solutions, but the world is changing and the market is changing every day. So the social protection systems and policies have to be dynamic. And this would require even easier policy formulation, adoption, and law approval. At the end of the day, I would like to thank the Economic Research Forum for organizing this important and timely event. And we look forward from this conference to address all the challenges that pension and social protection systems are facing the Arab countries. Although I have an issue of having Arab countries as a whole, because now we see them completely different, one country than another, as well as the impact of demographic changes, climate changes, food security, new work patterns, and this would have even get us more introduced to new work patterns, because while adding the technology, and by the way, we're automating all of our services in order to try to improve the governance mechanisms, because if we're speaking about inequality, we should have strong governance systems, and no governance without automation, without digital transformation, electronic payment, and lots of people are resisting this. And because of the mistrust between the citizen and the government, because everybody believes that the country wants to need to have more money from the person, while not understanding the social protection per se. And it's not only his fault or her fault, it's our fault as well, in order to disseminate sufficient and relevant information to people about social protection and social pension. Like, because they always say, احييني النهارده وميتني بكره, وإن how can I guarantee that the country will return back, and what I'm paying is much more than what I'm taking. So actually we need to settle this and find a sort of discourse between both parties. As well as the impact of demographic changes, new work patterns, and digitalization on these systems globally, and how to tackle these challenges. Finally, I think we're working on developing a social protection strategy. We have a program for orphanages, but I don't want to go into details. But I would like also to mention the input of the NGOs, and that's why we have an electronic network for NGOs in order to screen who's benefiting from what, when, and where, and how much. Because actually there are people who are paid double and triple, and others are not paid. So this also comes with the IDs. We issued more than 1 million IDs in the course of having Takaful and Karama. Especially in the remote areas, because if you don't have an ID, you're not really a citizen. At the end of the day, your rights are based and are identified with the ID. And that's why we have an electronic network for NGOs to govern. We know how much money is in the country and the NGOs receive, but we don't know how much they are really targeting the poor and how much, who's taking what. And that's why the beneficiary database is very important, in order to put the ID of the citizen to know what kind of benefits he took or she took from the government or from other NGOs. I think also the zakat issue have to be tackled, because the resources that we see running down in the country in terms of Gaza only, there are resources that are moving here and there. Same for donations for orphans, donations for whatsoever. But the issue is that when I ask them, why don't you donate formally? They tell me, the government will take them. So I told them, believe me, when I'm Minister of Social Solidarity, I trust you, or you trust me that I can do it. So he told me, you're a part of the government. So the issue is that how we can do this is very important. we're developing a program which is called Why, and Why is awareness, in order to work on the software. Because sometimes we're very focused on the hardware. It's not the hardware of buildings, but it's added to the structures and superstructures. But I mean, in terms of the software, especially of people in the rural areas, is too much. So that's why we're having a comprehensive approach as much as we can. We're very much open to comments, to critics, to suggestions. The situation, the main intention is that we want to have a strong social protection system that is equitable and that is sustainable and empowering, but not only the good intentions matter. We have to put this into policies, programs, and budgets. The budgets are there, relatively better than before. We need more, definitely we need more. But we need to move only at the bottom level and not at the top level. Thank you very much, and I really enjoy being with you. All the best.
Thank you very much, Your Excellency. This has been very informative. Her Excellency, we've been advised by her office that you do have a meeting immediately, so let us know if we can have one or two questions, or
Remain another quarter hour.
Okay, so if we take a couple of questions, and the first will have to go to Dr. Heba Handousa طبعا.
Her Excellency knows I've been on the ground for 12 years in the south.
The top, yeah, Dr. Heba.
And I was delighted at last at the end you mentioned NGOs. I think NGOs are the answer for Egypt because you have formidable numbers of them, and I've been able to work with them for 12 years. So my question is, do you trust that we may be able to deliver as NGOs, not just the big ones, which I consider we're quite big now, but even the smallest? I've been working entirely via NGOs in the South. I can't work without them. And I believe that on several fronts, the delivery costs less than the government delivering. And I'd like us to do a lot more of that work on the ground because it would save money. So what do you say?
Shireen, would you like to have 2 or 3 questions?
Yes, please. I thank you, Dr. Heba. Until we see if there's a question from the floor, we also have a question or a comment from Dr. Ibrahim Badawi online. Dr. Ibrahim?
Yes, thank you, Shireen. I would just like to really underscore and commend Her Excellency the Minister for making a very important statement about the inseparability between general economic policy, especially growth strategies, and social protection. This is an issue that we are very concerned about in the context of the emerging digitech economic order, whereby manufacturing is no longer available to provide large-scale job opportunities, and dealing with the consequences of this growth ecosystem on the labor market opportunity to provide jobs requires integrating both growth strategies as well as social protection policies and strategies. And I think this is a very important point made by the Minister. I just want to thank her and stress that point, and also suggest that at ERF we will be actually focusing on this issue as a major research.
Thank you, Dr. Ibrahim.
And social protection policies. Thank you.
Thank you, Dr. Ibrahim. I think we'll take one more question and then give the floor to Her Excellency.
Sorry, I thought there was someone before me. Good morning, everyone. Thank you, Your Excellency, for the very informative presentation. I enjoyed listening, and we learned a lot about what's happening in Egypt, and we can see the improvements, obviously. Now, but the approach, all in all, overall, is obviously a poverty alleviation approach instead of it being a universal rights-based approach, because we can see that a lot of resources are being spent, are being invested, and strategically as well, not only financially, but we can see that there is more social assistance kind, cash transfers, conditional and unconditional, and less so about social insurances, medical insurances. You mentioned some improvement in the medical insurance. I also wonder, I wonder why the approach is as such. And when you mentioned the improvements in medical insurance, my question is, how could that be the case when at the same time, in parallel and amidst the COVID crisis, we saw that serious discussions about shifts in the healthcare system have been ongoing, particularly in terms of privatizing the healthcare system and moving somewhat towards the poor Said model. So this is my first question. My second is, the social registry that you talked about is also reflective of the fact that your approach is a poverty alleviation approach. Why aren't we using the single registry so that social protection can be universal and can be provided to every Egyptian, regardless of whether they're poor or not, because this is their right. Social protection is their right. So why aren't we using the single registry? And the third part of my question is the residents. Egypt is hosting a lot of refugees, Syrian refugees, now Sudanese, and we never know how things unfold with Gaza. So how are you planning to provide social protection to the residents? And it would be a resident's right to social protection as well, because now we're only relying on UN agencies and on NGOs, and this is causing a lot of distortions in the market, particularly in the housing sector, and this is coming to the detriment somewhat of the Egyptian population. Finally, I see in the poverty alleviation program that we're focusing a lot on the poor, which is great. The rich are already doing well because they're rich and they have their own safety net and they diversify their portfolio, but there is a gap in Egypt, which is the missing middle, basically. The formal poor and the middle class is not getting, but you'll correct me if I'm wrong, this is my own perception, is not getting the same amount of attention. So I'd appreciate...
And with that, would you introduce yourself so we can give the floor to Her Excellency, the Minister, to get...
Sorry for not introducing myself. This is Farah Al-Shami. I'm a senior fellow and the Social Protection Program Director at the Arab Reform Initiative. I'd like to hear more from you about these. It's not that I'm throwing like set in stone statements, it's just to trigger the discussion.
Thank you very much. Your Excellency, you have the floor.
Thank you very much for the participants and for the colleagues to have these questions. I will start by answering Dr. Hiba about the NGOs. And I think there are lots of changes that happened in the NGOs, and I liked a study that's being turned by Abdul Latif. It's called Al-Marid al-Naim. They are married, but they are sometimes naim. And if you have the number of NGOs who have themselves registered now officially are 34,000 out of 53,000, which means that it doesn't mean that we have less NGOs. It means that we have some sort of flow of registration. During the period of 2012 to 2014, we increased with around 30,000 NGOs, new NGOs have been registered. We have a great disparity among the capacities of the NGOs. We have the big ones that run private sector and are able to mobilize resources, are using staff that are highly paid, even more than all of us. And this is the sector of certain number of NGOs, and they are well known, and every time we come to work with the NGOs, we go to the same partners. And the question is, the intermediate NGOs that can do a lot, and the community development associations at the rural level who used to work only in Hajj and Umrah, and now and then worked on services, and then now we tell them to work on advocacy and on big issues. So I think the NGO sector, they have, in doing some sort of assessment of their capacities, they are stuck with low capacity, especially the CDAs and some of the intermediate ones. And the big ones are great and are doing great, but we cannot rely on a capitalist NGO sector that you can rely only on certain number, which are the biggest, and then leave the others without any sort of protection or capacity building. There's a problem of automation, and that's why they found difficulty in registering themselves on the database, that electronic network that is automated. And I tell them, if you don't have a computer and if you cannot get yourselves registered, then and they cannot bring resources, why did you open the NGO? Yeah, I mean, why don't you? I'm not, al-Fikra, I'm not contradicting them, but I mean, even I liaise myself with a strong, with an intermediate NGO, but it's not in a matter of numbers, and that's why the 34. Added to the low monitoring from our part, because the staff is even getting less and less in the ministry. And I foresee that the ministry should not do the monitoring. As long as we do the registration, another body should do the monitoring in order to have a strong governance system, because you cannot have staff from our staff working after pension in the NGOs, and in the meantime they're monitoring them through their service. And that's why you need more resources in order to invest. Still, the NGO sector is contributing a lot, very much to the social protection, to the social development at large. Not only social protection, many of Second Kareem, of SMEs, are run basically by NGOs. But maybe, and that's why I insisted when I arrived to this position. I know this from a long time ago, of course, because I've been working in development for above 30 years, but I know that without automation you cannot really measure. And the issue of having more governance, and I think that the new law has added a lot, but unfortunately we just started it and started the electronic network, and then COVID-19 came, so we started to work not on the function, on the capacity, but on how much the NGO can deliver to people. So we tilted our attention to other services. But I do agree, and your esteemed NGOs is a very good example on developing lots, and I think we need to develop impact assessment of what the NGOs are doing. And I was just asking with the fund for NGOs, and we're having an academy for NGOs. So we're developing the infrastructure in order to have an NGO sector. You have an NGO fund that can provide resources, you have assessment, and you have automation, and also you have a monitoring mechanism. As for the economic and social protection growth that Dr. Ibrahim, and thank you very much, is an opportunity. I seize this opportunity to thank you for being there, and it's my pleasure and honor also always to be with you. I think having the growth we have in 2010 was there, but it was very inequitable. What's been spent on energy was even more than the combination of education and health budgets. So the growth was there. The issue is how to measure equitable growth. And I think it's remaining. Yani, I mean, the social protection, when it started, the main or the ultimate reason was having social justice. But did social justice prevail after all of these policies? I claim that no, we still have disparities and inequalities. And because the growth is not only inequitable, is intermittent. So we don't have a vision, a comprehensive vision for all of the clusters in order to develop and to get sustained. So we have all of a sudden better economic results, and then we go down whether irrationally knowing the real causes for this. And that's why I think we need an economic vision that is interrelated with social protection. I think also the investment policies, if we're speaking about economic issues and linking the investment issues, that's why they're having a rukhsa zahabiyya. But again, the policies are there. I think we need to work on the investment policies and the SMEs policies as well, because the villages have no job opportunities. There are no factories, there are no warehouses, there are no, the job opportunities are diminishing, and even the farmers now are buying bread and eggs. They are not any more productive families even for their bread winning. Finally, about the social insurance, about having the unified registry system, we do have it. We do have it, and actually apply all of our programs in coordination with the Administrative Control Authority that has a unified registry. Under this registry, there is 45 databases. Still, there are some, like the land tenures, for example, because people not always write the names of their land tenure under their names. But I mean, we're comparing all of our programs, starting from Takaful and Karama, cross-checking on monthly basis with the Unified National Registry. And nobody could have done it because, except if it is an authority that has an authority, because I myself as a ministry, I go for each ministry to have to ask for it. But I think also the Ministry of Telecommunication is doing a great job in having this holistic AHMOS program that combines with all of these programs. Finally, the refugees, we're supporting them. Part of the UN agencies are not supporting refugees per se. They are supporting around 230,000 persons out of 9 million. So we cannot say that the refugees came here and they don't return back to their countries. So you cannot open it. You're hardly covering. If we have 9 million refugees and we cover 5.2 million of our poor, how can the country work for it? So they're either integrated into the job market and keep their money here, not sending their money out, because by thus they are actually misbalancing the finance of Egypt, not only the economy. So either they get integrated into the work market and invest their issues not in their home countries but in the same country, or to return back, but you cannot open the door for 9 million is 2 countries. I mean, in certain cases, so you cannot cover all of this with social protection. Otherwise, the government will only work on social protection. But finally, the social insurance and the health insurance, we consider it, and that's why I have a social insurance reform. And I was just stating that the pension increased, but the contributory pension also increased. So it is parallel, it's input and output. You want to have a big pension, you pay more. But it has its own issues, and it's beginning to be, and it's not beginning, but it's in the midst of its automation. The policies that were adopted is that I'm a father and I died, so my daughter and then my sister and inherit the insurance. It was too much on the social pension, and that's why you're covering what's been there several years ago, 30, 40 years of having social pension while not paying. So the issue is that it's a business model. Definitely it has a social protection eye, but at the end of the day, it's a budget. It's a budget, and the country now is contributing because of the money that has been taken long years ago, and they are paying them back. But not only paying them back, but added also to the casual labor. Thank you very much. Maybe I'm too talkative, but the issues are too complicated. So you want to have as comprehensive vision as much as you can.
Thank you very much. Thank you, Your Excellency. Very rich, informative discussion. We're really grateful. We thank the panel. We thank Dr. Ibrahim, Dr. Ragi, Dr. Saba, and Your Excellency. Thank you very much for your time.
You're there for us all.
Thank you very much. Thank you very much.